Hi, my name's Matt. I'm a physio for myPhysioSA. If you're about to have neck surgery, then this video is for you, because I'm going to run through today some of the exercises that we give to patients post-surgery to help with the recovery period. Alright, so the most important thing after neck surgery is to try and get you moving comfortably and look at trying to get you back to normal day-to-day activities. So these next few exercises are designed to try and help with that. After surgery, there's a couple of things we tend to recommend some caution with, and one of those is lifting. So we just recommend that around about a 5 kilo lifting guide, roughly when you're trying to do things at home. And the other thing is with overhead movement. So we say that, you know, going up to shoulder height is okay, but in terms of lifting overhead, sometimes that can be a little bit irritating, and it's something just to be careful with when you're trying to do those sorts of activities at home. But the exercises we're going to go through today are about trying to get some movement back into the neck. So the first one is neck rotation or cervical rotation. Now, you could do this in lying down as well if you'd like. It's really whatever is most comfortable for you. So the first one we're going to do is just to gently go from side to side, looking left and right. And we say to do this 10 repetitions and then repeat it in 2 sets. And then you could do that 3 times a day. And for all of these exercises, you can follow that same principle of 2 sets of 10 repetitions 3 times a day. What you'll find is after surgery, it's normal to be a little bit sore. So we're not expecting you to be able to push that movement as far as you can at this stage. It's really just going to where you feel comfortable. So if you can only just get to there, that's okay. Yeah. With every day and every week post-surgery, you can try and work it a little bit further. Okay, so that's the first exercise. So the next one is about trying to get some movement happening in between your shoulder blades. So when you think about posture, sometimes you can be really quite stiff through the upper back and through the shoulder blades. So if you can be a bit looser through there, that's going to help relax the muscles through your neck. So what you're going to do in this situation is just with your shoulder blades, you're going to squeeze them gently together as far as you feel comfortable, and you should feel like your shoulders are going to go backwards, and then you're going to relax and come forwards. And then you're going to go backwards and then come forwards. Backwards and forwards. Okay, and repeat that 10 times. Alright, so the next exercise is a sit to stand exercise, and the idea of this is just to stand up and sit down out of a chair. It's something you do really regularly through the day, and it's just good to try and get some strengthening back into the legs and just to help with normal day-to-day functional activities. So all you do in this situation is you're going to bend forwards at the hips, so your nose are over your toes, push through your legs, come up into standing, and then sit down again, sticking your bottom out behind. So standing up, coming forwards and sitting down. And then the last exercise to go through today is a squat. So in standing, you can have a bench or a chair or a table in front if you need to for a little bit of support with balance. You can do it with a chair behind as well. But what you're going to do in this situation is basically squat down as far as you feel comfortable. So you're going to bend at the middle, squat down and come back up again. So stick your bottom out, bend at the hips, bend forwards and coming up again. And that's helping to prepare you for normal day-to-day activities that involve bending. Thanks for listening today. I hope you've got something out of it in terms of some ideas of exercises that you can do following neck surgery. I think the most important thing to take home from today is that it's about getting normal, comfortable movement back into your neck and gradually getting back to day-to-day activities. We're not expecting that you're going to be able to push movement as far as you can in the first instance. It's about building it up slowly, and the key is to be comfortable whilst you're performing the exercises. It's also normal to have some soreness post-surgery, and that's why as your muscles get used to working again, going forward. So if you have any concerns, it's important to get in touch with your physio and discuss with them, because most of the time it is a normal muscle related soreness. And lastly, it is important to check with your surgeon for what their recommendations are, because surgeons are different and sometimes the procedures in surgery are slightly different. So double check with them to make sure the exercises are right for you.